Every 66 seconds, another senior in this country receives the word dementia. By the time this video ends, 20 more families will have heard that diagnosis sitting across from a doctor they trusted. And for some of those families, not all, but some, age was never the true cause. The cause was a bottle sitting quietly on the bathroom shelf. One they had been told was perfectly safe. One a doctor signed off on, a pharmacist dispensed without a second thought, and nobody ever questioned again. I'm Dr. Sophia, and after years in clinical practice, I have watched this same scene repeat itself more times than I am comfortable counting. A patient who was sharp their entire life, quick with names, reliable with dates, clear in conversation, begins losing the thread. Slowly at first, then faster. Names slip away, appointments vanish. The drive home they have made 1,000 times suddenly feels unfamiliar. And everyone around them, family, friends, even other doctors, writes it off as getting old. It was not aging, it was a medication, one that almost nobody thinks to question, because a doctor prescribed it and a pharmacy filled it, and that combination feels like a guarantee of safety that it simply is not. Here is what the research keeps confirming, year after year. Certain ordinary, everyday classes of medication, drugs sitting in millions of medicine cabinets right now, can pull memory and cognitive function down significantly within as little as a single year. And most of the people taking them have no idea it is even happening. Today on Wellness by Dr. Sophia, I am walking you through the 9 medications most closely linked to accelerated memory loss in adults over 60. We are counting down from the ones that quietly fly under the radar, all the way to what I consider the single most destructive pattern of all. Pay close attention when we reach number 3. It is prescribed to millions of seniors for something that sounds completely harmless, and it may be affecting your brain's memory centers right now without a single warning sign. Before we begin, leave me a comment below. Tell me your age and what medications you are currently taking every day. I read every single comment, and what this community shares directly shapes the topics I cover next. Now let's get into it. Number 9, diphenhydramine. You know it by its drugstore name, Benadryl. It is a small, inexpensive tablet people reach for to fall asleep, calm an allergy, or quiet a cold. It requires no prescription. It sits out in the open on pharmacy shelves. And because of that, most people assume it must be gentle. It must be harmless. After all, if it were dangerous, surely it would not be available without a doctor's signature. Inside your brain, something very different is happening when you take it. Benadryl belongs to a class of drugs called anticholinergics, a long word for a precise concept. These medications block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain relies upon to lay down new memories, retrieve stored ones, and maintain alertness through the day. As we age, the brain naturally produces less of it, and depends even more heavily on whatever remains. A drug that blocks acetylcholine hits a 70-year-old brain with a force that a 30-year-old brain would barely register. The structure that suffers most is the hippocampus, the small, seahorse-shaped region where new memories are formed before being filed away into long-term storage. Research published in the Journal of Geriatric Cognitive Health found that older adults who used anticholinergic drugs regularly carried a 54% higher risk of developing dementia compared with those who avoided them. More than half, again the usual risk, from something most people treat like a harmless sleep aid. Check every label on anything you take for sleep, any product marked PM, nighttime, or allergy relief. These are very often simply Benadryl wearing a different commercial name. If you take it for allergies, newer antihistamines like loratadine, sold as Claritin, do not cross into the brain the way Benadryl does and are considerably safer over the long term. Never stop a medication abruptly on your own. But stop assuming that over-the-counter automatically means harmless for your memory. It does not. Number 8, proton pump inhibitors. The familiar names here are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications shut down acid production in the stomach and are prescribed widely for heartburn, acid reflux, and that burning discomfort after meals. People often stay on them for years, sometimes for a decade or longer, because the moment they try to stop, symptoms return with full force. The drug begins to feel like the only thing holding the symptoms in check. Here is what almost nobody hears at the pharmacy counter. Your stomach requires acid to absorb certain critical nutrients from your food. Chief among them is vitamin B12, a nutrient that protects the wiring of your nerves and your brain. Suppress enough acid for long enough, and B12 levels quietly decline. So do magnesium and calcium, two minerals your brain cells depend on to fire signals correctly. Starve neurons of those building blocks consistently, and you begin to see misfires, confusion, and memory slips that can closely resemble early Alzheimer's disease, when the real cause is a nutritional deficiency your medication has been quietly creating the entire time. A large study in JAMA Neurology examined more than 73,000 adults aged 75 and older. Regular proton pump inhibitor users showed a 44% higher risk of dementia than non-users. The issue runs even deeper than nutrition. These medications have also been shown to raise amyloid beta levels in the brain, the sticky protein that accumulates in Alzheimer's disease. If you take a proton pump inhibitor every single day, bring it up with your physician. Many patients can transition to a gentler class called H2 blockers, like famotidine, sold as Pepcid, which carry far less cognitive risk. Number 7. Bladder medications. The one worth knowing by name specifically is oxybutynin, sold as Ditropan. It is prescribed for overactive bladder, the sudden, urgent need to reach a bathroom that can quietly take over an entire day. The relief it provides is genuine. The embarrassment it spares people is real. But oxybutynin works by blocking acetylcholine, the same memory chemical that Benadryl blocks, and it crosses into the brain with particular ease, lodging in the very regions where memories are formed. A study published in the British Medical Journal followed adults over 65 who took strong anticholinergic medications like oxybutynin for more than a year. Their dementia risk climbed 49% higher than those who did not. And here is what troubles me most about this finding. Almost none of them were warned. They were told this pill would help with the bladder. Nobody mentioned it might also be quietly dimming their mind. The cognitive fog gets attributed to age. Patients describe forgetting appointments, misplacing items repeatedly, losing the thread of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real, meaningful ground has already been lost. If you take oxybutynin and you have noticed your memory declining, take that concern seriously. Newer medications like mirabegron, sold as Myrbetriq, work through an entirely different biological pathway and do not block acetylcholine at all. For most older adults, they deliver comparable bladder control with significantly less cognitive risk. Bring this to your next appointment. Number 6. Statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, rank among the most widely prescribed medications in the world, particularly after age 60. They do important, life-protecting work by lowering cholesterol and reducing the risk of heart attack and stroke. Statins have a rightful place in many people's lives, and this is not an argument against using them. What follows is simply the half of the story that is almost always left out of the conversation. Cholesterol does far more than affect your cardiovascular health. Your brain is composed of nearly 60% fat, and it depends on cholesterol to build the myelin sheath, the insulation wrapped around every nerve fiber that allows signals to travel quickly and cleanly. Push cholesterol down aggressively enough with a sufficiently powerful statin, and you can leave the brain short of a raw material it genuinely requires for proper function. Research published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years showed a 26% higher rate of mild cognitive impairment. And the higher the dose, the more pronounced the decline. Some patients describe unsettling gaps, a familiar name that simply vanishes, a conversation already forgotten minutes after it ended, a route driven for 20 years that suddenly feels unfamiliar. Not every statin affects the brain identically. Pravastatin and fluvastatin do not cross into brain tissue as readily and are generally considered safer choices when preserving cognitive function is a priority. If you have been on a statin for years and you are noticing fog or forgetfulness, that is a real conversation to have with your doctor about adjusting the dose or exploring an alternative. It is never a reason to stop unilaterally. Get the right plan with professional guidance. Number 5. Benzodiazepines. Lorazepam sold as Ativan. Diazepam sold as Valium. Alprazolam sold as Xanax. These are among the most commonly prescribed medications in America for anxiety and sleep difficulties. They work by amplifying GABA, the brain's natural calming signal, dialing down an overactive nervous system. At first, they can feel like a genuine lifeline. The panic eases. Racing thoughts slow. Sleep finally arrives. The relief is real, and that realness is precisely what makes them so difficult to question. Over time, however, the picture changes considerably. A study in the British Medical Journal followed more than 8,000 seniors over 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, like diazepam, appeared even more dangerous because they linger in the body and accumulate in fatty tissue, including brain tissue. What these medications produce over time is a slow chemical sedation across the entire brain. Learning slows, mental flexibility drops. Many people describe a kind of emotional numbness, a feeling of moving through fog, no longer quite recognizing themselves in the mirror of their own thoughts. And the cruelest part is what happens when they try to stop. If a benzodiazepine is discontinued abruptly, anxiety and insomnia can return even more intensely than before, paired with agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the most harm. Taking a benzodiazepine for more than a few weeks, do not stop suddenly. Doing so can be life-threatening. Work carefully with your physician to taper the dose gradually over weeks or months. Buspirone can ease anxiety without sedation or cognitive fog. Specialized therapy approaches, built specifically for insomnia and anxiety, can also restore calm without any toll on the brain whatsoever. Number 4. Amitriptyline. Sold as Elavil, this is an older antidepressant that remains widely prescribed today, not only for depression, but for nerve pain, sleep difficulties, and even migraine prevention. That versatility is exactly why it became so common. A single medication that appears to address 3 separate problems can seem like an elegant solution. But beneath the surface, amitriptyline is one of the most potent anticholinergic drugs still in regular clinical use, meaning it blocks acetylcholine, the memory chemical, with considerable force. With long-term use, memory problems do not remain a rare side effect. They begin to look like an expected outcome. A landmark study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs like amitriptyline over a 10-year span showed a 54% greater risk of developing dementia. And the overwhelming majority were never once warned that their medication could do this. They were prescribed it for sleep or pain, noticed their memory gradually thinning, their concentration weakening, their words slipping away, and simply assumed it was age. It does not even require a high dose. A small nightly amount taken consistently over years can quietly erode cognitive function with no obvious warning signs until the loss has already become substantial. If you or someone you love takes amitriptyline, that is a conversation worth initiating soon. For nerve pain, duloxetine or gabapentin may provide comparable relief without the same anticholinergic burden. For sleep, low-dose doxepin is generally much gentler on this pathway. For mood, newer antidepressants like sertraline are considered far safer for long-term brain health. Number 3. Paroxetine. This is the one I flagged at the beginning of this video. Prescribed to millions of adults for something that sounds entirely manageable, and it is the entry on this list that concerns me most, precisely because of how innocuous it appears. Paroxetine, sold as Paxil, is a member of the antidepressant family known as SSRIs. It is used for both depression and anxiety. On the surface, it presents as a modern, gentle medication, far kinder than many older psychiatric drugs. Here is the critical detail that rarely gets discussed openly. Paroxetine is the one SRI that carries significant anticholinergic activity. That single characteristic separates it sharply from closely related medications like sertraline and escitalopram, because it disrupts the same acetylcholine system that every other drug on this list has been disrupting. A large review in Frontiers in Psychiatry found that older adults taking paroxetine showed measurable declines in short-term memory, word recall, and attention within the first 12 months of use. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those taking other antidepressants. There is a particular bitterness in that finding. The medication is prescribed to stabilize and support the mind, yet over time it may be chipping away at the very clarity it was meant to protect. The American Geriatric Society placed paroxetine on the Beers criteria, a formal, peer-reviewed catalog of medications considered potentially inappropriate for older adults, for exactly these reasons. If you take it, speak with your doctor about transitioning to sertraline or escitalopram, which are genuinely gentler and do not carry the same documented cognitive risks. Number 2, antipsychotic medications. This entry concerns me deeply, and for a reason that goes beyond pharmacology. Many people taking these medications never knowingly agreed to take an antipsychotic. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These drugs were originally developed and FDA approved for serious psychiatric conditions like schizophrenia and severe bipolar disorder. Today, they are frequently prescribed off-label to older adults for sleep difficulties, mild agitation, or restlessness connected to cognitive decline. Powerful medications built for severe psychiatric illness are now routinely used in homes and care facilities for seniors who are simply confused, restless, or difficult for overstretched caregivers to manage in a given moment. The consequences can be severe. A study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to experience accelerating cognitive decline within a single year, even with no prior history of dementia. These medications also raise the risk of stroke, cardiac events, and the heavy sedation that directly contributes to falls and hospitalization. They work by suppressing dopamine, a chemical connected not only to mood, but to focus, planning, decision-making, and memory. Suppress dopamine enough and the brain grows slower, less responsive, less present. Families describe watching someone they love become emotionally flat, seemingly absent, and they assume it is the disease progressing, when the chemical cause may be sitting in a prescription bottle. If a loved one is on one of these medications, ask the prescribing physician directly, why was this started, and is it genuinely necessary? Many behavioral symptoms improve substantially without medication, through consistent routines, reduced overstimulation, treating undiagnosed pain, and improved sleep environments. Number 1. Anticholinergic polypharmacy. Number 1 is not a single medication, and that is precisely the point and precisely why it claims this position. The greatest threat to the aging brain is often not one drug in isolation. It is the slow, invisible accumulation of several anticholinergic medications taken simultaneously, with no one ever adding up the total burden. Polypharmacy means taking multiple medications at once. Anticholinergic burden refers to the combined effect of all those medications blocking the same memory-related brain chemistry at the same time. Consider a scenario that is more common than most physicians realize. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder control, amitriptyline each evening for nerve pain. Individually, each medication might produce only a modest, barely noticeable cognitive effect. Together, the load on the brain multiplies, and the acetylcholine system, already depleted by age, becomes overwhelmed from multiple directions simultaneously. Research published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years, more than double the risk. And the vast majority had no idea they were even taking anticholinergic medications. Nobody had explained it, nobody had added it up. When acetylcholine is blocked from several directions at once, neurons do not simply slow down temporarily. They can begin to weaken from chronic underuse. Neural connections may thin. The brain can settle into a quiet, underpowered state that closely resembles Alzheimer's disease on cognitive testing, when the actual cause is chemical, cumulative, and in many cases entirely reversible. That last word is the one I most need you to hear. Medication-induced cognitive decline is frequently reversible when identified early. Reduce the burden under medical supervision, and many people begin to regain clarity, sharpness, and memory within weeks to months. The brain is far more resilient than most people are ever told, but only once the source of ongoing harm has been identified and removed. The fix does not require a miracle. It requires a careful, deliberate medication review. Sit down with your physician or your pharmacist and go through every prescription, every over-the-counter product, and every supplement you take. Ask specifically about anticholinergic burden. Simple, validated scoring tools exist to help calculate that cumulative risk. Once the problematic medications are identified, unnecessary drugs can be tapered or discontinued safely. Safer alternatives can be introduced, and your brain can be given a genuine fighting chance to recover what it has quietly been losing. This is why I made this video today, not to frighten you, not to make you distrust every medication you take, but because the information I shared with you today, information that is sitting in published medical journals, on the Beers criteria list, in geriatric clinical guidelines, is information that most patients over 60 have never once been told in a doctor's office, and they deserve to know it. Your memory is not simply declining on a fixed, predetermined schedule. Your brain is not simply doing what aging brains do. In many cases, there is something specific happening, something identifiable, something addressable, that is driving the fog and the forgetfulness that has been written off as inevitable. You deserve to know what is in your medicine cabinet. You deserve to have that conversation with your doctor. Not next year, not when symptoms worsen, but this week. Print this list if you need to. Bring it to your next appointment. Ask the direct question, am I carrying a high anticholinergic burden? Could any of my current medications be contributing to what I have been experiencing cognitively? That question, asked clearly and at the right time, may be one of the most important questions you ever ask about your own health. Before you go, I want to hear from you. Of these 9 medications, which ones are currently in your home? Have you noticed brain fog or increasing forgetfulness after starting something new? Tell me in the comments below, and tell me you will ask for a medication review this week. Your answer may be the very thing that leads the next person reading the comments section to take the same step, and that step may change everything for them. I am Dr. Sophia. This is Wellness by Dr. Sophia. Take care of your brain because it takes care